Knee ligament ACL tear, it's a common problem. Myself, Dr. Jayakrishna Reddy, Orthopedic surgeon at Yashoda Hospitals, Secunderabad. So knee ligament, in knee we have 4 ligaments, and main ligament is ACL ligament, which is commonly prone for injuries in contact sports and in road traffic accidents also. When patient comes in contact with a twist injury, his knee is twisting to one side and ankle is to other side, they are prone for ligament injuries. In such cases, we have to initially treat with rest ice and keep the leg elevated so that swelling is reduced. Once acute pain is reduced, we can re-examine the patient again and get an MRI scan done. So if the scan is, if we confirm it's torn, then he or she has to go undergo surgery. This ACL arthroscopic reconstruction surgery is a minimal invasive surgery where we keep couple of holes into the joint and insert a camera inside and take patient own tendon. It can be hamstring or quadriceps or peroneus, depends on patient what profession they do. If it's a sports person, we take a quadriceps tendon. If it's a less demanding person, hamstring. And if it is a very obese people, then we take peroneus tendon also. And sometimes we augment it with a tape or a synthetic graft so that the strength will be more and the recovery also will be faster. So since this is done with arthroscopy and recovery is also fast, and they can get back their own regular activities, whatever they were doing previously. And post-operatively, they need to do proper physiotherapy exercises, and next day they can start walking with full weight bearing with a single stick support for a couple of weeks. After that, without any support, they can start walking. And after 3 months, gradually they can go back to their sports training activities and gym activities, and after 6 months, back to regular their profession, whatever they were doing.
If you found this video useful, like, comment, and subscribe for more health updates.